Good morning, everybody. I'm Professor Tarun Lahiri Mazumdar. I'm heading the Department of Gastroenterology, AMRI, Mukundpur, Kolkata. It's a pleasure to talk to you about our recent concept of liver disease, which is practically endemic all over the world. We had the idea that it's only alcohol which damages liver, viruses which damage liver, but now we know that even without these agents, a person can develop non-alcoholic fatty liver disease. Unfortunately, if it is not taken care of, it leads to hepatitis. We call it steatohepatitis, and if it is not treated, it goes to the stage of fibrosis, then to cirrhosis, and after 20 to 25 years, it leads to liver cancer. It is not usual for a person to go for test for liver as such. When you have a routine health checkup, as you check your blood sugar, cholesterol level, similarly, if you look for liver function test in blood, then only it is apparent that there is something wrong with the liver, and a simple ultrasonography of liver leads to the diagnosis. Our concepts are changing. We are very much concerned about our heart, but very few of us really know that genesis of heart disease is from the liver. If the liver is not all right, then and then only this heart is affected secondarily. And most of the patients, say 40 to 45% patients having heart disease, they have underlying fatty liver disease. What to do about it? Because it needs attention, yearly health checkup, including blood test and sonography, will make a diagnosis of fatty liver disease. And once it is found out, then we hepatologists look for the cause for this fatty liver disease. It may be associated with overweight, obesity, and cholesterol problem. We call it dyslipidemia. But the other end of this fatty liver disease is that even a person can develop fatty liver without obesity or so-called metabolic changes. So far, very few drugs have been found to be effective in treating this disease. It is usually control of the metabolic problems and regular exercise. It is exercise which help a person to get rid of this fatty liver. It is postulated that with walking or exercise, the insulin is stimulated, and this insulin goes inside the liver and cleans the fat out of the liver cells. So we always recommend change in lifestyle, having healthy food, which you all know, regular exercise, and especially walking, which should be the first step in treating fatty liver disease, keeping in mind that if it is not taken care of, fatty liver disease will lead to cirrhosis and finally to liver cancer. Many medicines are on the way. We are having a lot of research work on these medicines which can help in treating fatty liver disease, and we would be very soon we'll be getting some of the good drugs which can help fatty liver disease. It is a question of how aware we are, because fatty liver disease does not give rise to any symptom. It is only routine checkup by blood test and sonography where we pick up this disease And to see the significance of this disease, we can do fibroscan of the liver. We can do CT scan or MR to assess the degree of fat accumulation inside the liver. Out of this, fibroscan is a very important tool because it gives rise to features of fibrosis. If somebody is going to cirrhosis, before cirrhosis, one person will have some degree of fibrosis, and fibroscan will pick it up, and the patient can be advised accordingly. Earlier, we used to do liver biopsies, especially when the patient undergoes any surgery of gallstone disease. It is very interesting to see that most of the patients who develop gallstone disease, they have underlying fatty liver disease. Therefore, we believe that just removal of the gallbladder is not the final treatment. A person who is having gallstone disease, he should be investigated for liver disease, and if possible, the surgeon should be able to take a liver biopsy during surgery, which will give us the exact situation inside the liver. And therefore, please do not go with this idea that treatment of gallstone disease is just removal of the gallbladder. There is a cause behind it, and most likely it is due to fatty liver, and therefore they should be advised regarding their lifestyle and regular follow-up. Thank you very much.